Ok, c'est un plaisir de conduire.
Morning.
Good morning, how are you?
I'm good. How are you?
Getting ready to head out. Early morning.
We got a little bit of a journey ahead of us.
We sure do. Yeah.
In 2008, I came on as faculty in the Department of Family Medicine at the University of Illinois in Chicago. Having a very strong interest in global health, wanted to develop a global health track for the resident physicians. Something that strengthens local health systems so that, in effect, local health workers can themselves care for local populations and ensure quality over time as opposed to just when our group visits. In order to develop that model of engagement, that model of partnership, we really needed a strong footprint on the ground. PeaceCare is a nonprofit organization that is meant really to bring together resources. It's a partnership agency.
PeaceCare is exciting because they've been here for 5 years and, has the potential to do a lot of really great work.
So this is the Peace Corps Volunteers Home. It's very camp-esque, which we like.
The Peace Corps exists in many countries around the world, 65 plus countries. They do excellent work at the community level. They speak the local language, they do extraordinary work. We really want to collaborate together in global health.
We have volunteers representing all 3 sectors, which are health, agriculture, and community economic development.
Yet, oftentimes, Peace Corps volunteers have relatively limited technical expertise.
I've had volunteers in this region for over 40 years. Hi, guys.
Myself, along with several other of my colleagues, began to really think about how we could bring these worlds together.
We can provide a lot of on-the-ground knowledge. We know local language. We have those relationships built.
I had a really terrific Peace Corps experience when I was a volunteer in Mauritania, where I truly developed a sincere and deep understanding of global disparities and the need for basic primary healthcare services. Africa has about 10% of the world's population and carries about 24% of the disease burden, but it has only 3% of the global healthcare workforce. That's an extraordinary shortage. So in 2010, we began our partnership with Peace Corps Senegal. They guided us to work in the Kédougou region, which is the far southeastern region, and introduced us to Dr. Youssef Ndiaye and said, you really should work alongside him.
Hello. I got a flu in Montreal. That's why I'm heavy dressed.
So we developed together an assessment process whereby we looked at what the priorities were at the local level in many communities through focus groups.
Qu'elles sont en ménopause, elles pensent que normalement elles ne devaient plus partir à la maternité. Et c'est même les dépistages, quand on fait ça dans les villages, on demande aux femmes de venir, les femmes de 40 ans.
Right. The impact of cervical cancer is quite significant. It's the #1 cancer killer among women in Senegal.
On a étudié la prévalence du cancer du col, du dépistage du cancer du col chez les femmes entre 40 et 45 ans et qu'elle est en deçà de 2%. Et après 45 ans, elle est de 0% le dépistage. Cela veut dire pour chaque femme de plus de 45 ans, il n'y a personne qui se dépiste pour le cancer du col.
Dr. Johane is relatively new to the region. He has a family in Montreal, but he is back working in Senegal for the sole reason of being able to give back to his country.
Ça veut dire en réalité, moi je n'accepte pas qu'on dise parce qu'on est pays sous-développé qu'on doit mourir plus tôt que les autres. Never small. It's always big. It's from the heart.
Jamnaoui.